For the dental implants to work the best, there are a few things that we need to do, right? We need to make sure that we have bone. We need to make sure that the patient is a candidate. To be able to determine that, we have to have a three-dimensional CT. And after that, we have to clinically evaluate this site. And we have to make sure that the patient is healthy to receive the implant. If we cannot place a proper restoration on an implant once it heals, it really doesn't mean anything. This is basically considered a restoratively driven implant placement. One thing the patients can ask is the experience of the doctor. If they have any additional certification in addition to their dental degree, if they have done advanced training in such as prosthodontics or surgery, periodontics. Here in small rehab centers, I have done thousands of implants. I have restored thousands of implants. My staff, my assistants, they have assisted implant surgeries, implant restorations for many years. The hygiene appointments are very, very crucial, especially for full arch restorations. These patients, they have to come back every 4 to 6 months, depending on their overall health, and to make sure that they clean properly and to make sure that everything is checked on a regular basis, because there are a lot of screws and abutments involved in this treatment. So we want to make sure that everything is maintained. There are a few signs that will show that implants are failing. Basically, it's pain, swelling, or mobility, inflammation in that area. And if one of these or all of these are happening, it's crucial that the patient calls the office right away, and we will come up with a solution for that. If you feel like you are having a problem with your implant, call us immediately. We will help you save your implant and get your smile restored.